is Dr. Quiet. It's very nice to meet you. I'm just here today to give you a cranial nerve exam. I'm just going to be looking at the muscles and nerves around your face area to make sure that everything is working properly. Are you currently in any pain? Okay, good. If you are in pain, I would want to go ahead and assess that immediately. And what is your name? Okay, thank you. How did you spell that last part? Okay, thank you. And what is your date of birth? What was that? Okay, thanks. And have you ever had a cranial nerve examination done before? Okay, no, all right. Well, I just want you to know you should never feel any pain or any discomfort at all. There may be moments where it's, slightly uncomfortable, or I'm just kind of in your personal zone. But other than that, if you feel any pain or discomfort, please let me know, because this should be actually quite relaxing. All right, good. Alright, so first we're going to have a look at your first cranial nerve, and that is your olfactory nerve. Now, a lot of doctors like to skip this, but we don't skip this here because the olfactory nerve can indicate quite a few things going on in the brain. So, have you had any changes in your smell or taste lately? Is anything tasting funny or smelling different than it used to? Okay, good. All right, well, sometimes, even if we don't notice, we will have some issues with our smell. So I'm just going to do a quick test on your scent, and this won't take but just a second. And I don't even have to touch you for this one. I've got 3 different scents here. We're going to start off with the first one, and I'm just going to have you smell this for me. And what does that smell like? Very good, that is cinnamon. Next one, same thing. Just smell of that for me. And what does that smell like to you? Vanilla, that's right. Last one. Just smell that for me. And that's right, coffee. Actually, really like the smell of coffee. So you aced that. No problems with your smell, as I suspected. You were able to smell the cinnamon, the vanilla, and the coffee. My favorite. Alright, so that's it on the olfactory nerve. Cranial nerve number 1 is clear. Alright, next we do a cluster of cranial nerves that all have to do with the eyes. Cranial nerves 2, 3, 4, 6, and 8. We've got the optic, oculomotor, the trochlear, the abducens, and the vestibulocochlear. Yeah, quite a few at once. So, do you wear any glasses or contacts? Okay. Alright, well, I'm just going to be testing a few things regarding your eyes. there's going to be a few moments where I'm going to be getting into your personal space. I have to get really close to your eyes to make sure that everything is normal. But before I do that, I'm going to just put a little bit of this Purell on my hands, since I am going to be getting up close to your face. Alright, just get my light here. Alright, first I'm just going to take a look at your optic nerve. Just doing a general inspection of your eyes, just kind of at a glance here. Okay. Alright, now I'm just going to have you look over my shoulder, and I'm going to come in close with the light. I'm going to be getting into your personal space. Just look right over my shoulder. Again, just keep looking over. Now again, I'm going to do it on this side now. Just continue to look over my shoulder. One more time, just look over my shoulder again. Okay. This looks normal. All right. That looks good. Next, I'm just going to be looking for the venous pulsations in your eyes, and then the fovea. Alright, again, just look right over my shoulder. Alright, we've got the pulsation there. Okay, look at the light. Okay, and there's the fovea, so that's normal. Other side again, looking over my shoulder. Okay, got the pulsation. And look at the light. There's the fovea. Very good. Everything looks good. Got the venous pulsation. Normal. And the fovea was normal on both eyes. Alright, now I'm going to be testing your visual acuity. This is just a really quick test, kind of similar to when you go to an eye doctor, an ophthalmologist, but this is going to be much quicker, much less detailed. I'm not really interested in how well your sight is working. It's more about your nerves reacting the way that they're supposed to in your eyes. So I'm going to have you cover up your left eye for me, and I want you to read the lowest line here. Very good. All right, now cover up that other eye. And now I want you to read that again, but this time go backwards for me. Very good. All right. So yeah, just as simple as that to test your visual acuity. Let me just put this chart away. You have very good vision, nothing affecting that. Okay. All right. Okay. I'm just going to have you look at my forehead right here. Don't move your eyes or your head from my forehead. I'm going to pop up a few numbers right around here, and I just want you to tell me what numbers you see. Okay? All right. Good. 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 All right, very good. So your visual acuity seems to be pretty good as far as that test. All right, I'm going to get you to cover your left eye again, and I'm going to be wiggling my fingers like this and bringing them into your field of vision. When you can see it, please let me know, okay? All right, now just go ahead and cover that eye. Good. Good. Okay. Okay. Good. Good job. Just a couple more. Good. And good. Very nice. Yep, everything seems perfect so far. All right, now I'm just going to quickly test for your blind spot. Now go ahead and cover up your right eye. I'm also going to cover up my right eye. And tell me when you see my finger disappear. Okay, and now when it reappears. Good. And when it disappears. Okay, and reappears. All right, very good. We're going to do the same thing, but with the left eye covered. All right, tell me when my finger disappears. Good, and reappears. Good, and disappears. Good, and reappears. Very good. Yep, that is absolutely normal. Everybody's got a bit of a blind spot. All right, now I'm going to be shining the light in your eye again. I'm just testing your pupils to make sure that they are constricting properly. Okay, I'm just going to get kind of close to you so I can see. Okay, good. And this side. All right, good. Yep, you're doing very well. Yes, I'm just filling in your chart as we go along. I like to keep a detailed history of my patients so that way if anything changes, I know about it. All right, now I just need to check another type of pupillary reaction. Now I want you to look at my forehead. Just focus right here, right on my forehead. Now look at my finger. Okay, now one more time. I want you to focus on my forehead. Now look at my finger. Okay, good. Alright, so we've got direct, central, and near. Okay. I have not noticed any droopy eyelids. Nothing where it shouldn't be. Okay. Alright, I just want you to keep your head still, keep looking at my face, and I want you to look left with your eyes, right with your eyes, up and down, down to the left, top to the right. Alright, good. Alright, now I want you to do similar, the same thing. Just keep looking at my face, keep your head still, but I want you to follow my fingers with your eyes. Good. Doing great. Very nice. Keep your head still. All right, very good. Now, have you had any issues with double vision? Okay. Oh yeah, that's fine. All right, I'll be testing your vestibulo-ocular cortex now. I just want you to look at my palm and keep your eyes focused on my palm, please. And now move your head up, down, left, right. Good job. Just follow my head. Keep looking at my palm. All right, good. Now I want you to look at this palm. Do the same thing. Just keep your eyes focused on my palm, but look up, down, left, right. Follow my head. All right, very good. Your vestibulo-ocular reflex is perfect. All right, and it's time to move on to cranial nerve number 5. That is the trigeminal. Now, I'm just going to be testing some of your facial expressions. Some of this might feel a little bit strange, but it should not be very uncomfortable. Okay. I am going to be touching your face and getting into your space a bit. All right. Now I'm just going to be touching your face, and I want you to tell me everywhere I touch it if it feels even and normal everywhere I touch it. Okay? All right. Okay, good. 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 Okay. Okay, good. Everything feels even and normal. All right, good, perfect. All right, now I need to test your corneal reflex. This is probably going to be the most uncomfortable part of this exam, but it's not too bad. So what I need you to do is just keep your eyes open wide for me. I'm going to take this Q-tip, and I have pulled out a wisp here. So you can kind of see it just like that, just this teeny tiny little wisp at the tip there. I'm going to touch your eye with that. Yeah, it's just a little bit of a surprise, but don't worry about it. I'm just testing for those reflexes, which I'm sure will happen. All right, eyes open wide. I see, not so bad. Yeah, your reflex is working fine, but let's go ahead and test it on the other eye. Very good. Yeah, done with messing with your eyes for now. Well, what we're looking for is for both eyes to close. Even if we're just, swabbing that one eye, both eyes are supposed to close at the same time as soon as a wisp touches the cornea. Yeah, yeah, you definitely did. All right, now it's time to bring out the tuning fork. Oh yeah, I've got an actual tuning fork. So what I'm going to be doing is I'm going to be tapping this on my hand, and then first I'm going to be placing it onto your cheekbones like this on either side. I just want you to tell me if when I do that it feels even, okay? It feels the same on both sides. All right. Okay, good. Good. All right, and now same thing but on your forehead. Does it feel even across your face? All right, good. So yeah, everything seems normal. All right, I want you to clench your jaw for me. I need to check out those jaw muscles. Make sure they're nice and strong. Yep, clench for me, please. Good. Okay, now wiggle your jaw back and forth. Good, 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 good. Yep, your jaw muscles are pretty strong. Okay, but one more. I want you to open your mouth for me. No, you don't have to say ah yet. Just open your mouth, and I'm going to try and close it, but I want you to not let me close it. All right, yep, open up. All right, good. Yep, you can close now. Nothing wrong with those muscles. All right, and we're moving on to cranial nerve number 7, the facial. All right, I'm going to be checking for infranuclear or supranuclear issues. That's just fancy talk for where in the brain there could be a problem. A lot of the times if patients have strokes, which I know you're not having any problems with that right now, but the difference in whether your forehead is drooping or not, along with other parts of your face, makes a huge difference in how we treat it. All right, I want you to look up at the ceiling for me. Yeah, just like this. Okay. Yep, you can just look normal now. Alright, we're going to do a quick taste test. There's probably nothing wrong here. There's usually nothing wrong, but like I said, I like to do a thorough examination, and even though a lot of people will skip the taste test, I think it's important to just make sure to cover everything, especially while you're here. Oh yeah. Okay. So I have a few jars of just liquid like this. They all look the same, but they all have different flavors. So I'm going to be dipping this into the solution, and I need you to go ahead and stick your tongue out for me. Okay. And I'm going to dab some of this onto your tongue, and I want you to tell me what you taste. Okay. Yep, salt, that's right. Good job. So you are able to taste salt. Alright, next. Alright, tongue out again, please. And what is that? Yep, sour. Good job. So no problems tasting sour. Yeah. We're just going to do one more because it seems like your taste is just fine. All right, tongue out again. And what do you taste? Sweet, that is correct. Very good job. Another test passed. Yeah, it really is a quick and easy test, so I don't see much point in skipping it. We are almost done filling out this chart for you. Oh yes, you seem very healthy. I'm going to bring out that tuning fork again. I'm just going to see if you have any hyperacusis, just sensitivity to very loud noises essentially. Alright, I'm just going to tap this and tell me if you hear everything normal and even. Alright. Okay. Good job. No, you do not have hyperacusis. But other than that, how has your hearing been lately? Have you noticed anything different? Any noises louder or quieter than normal? Okay, good. All right, I'm just going to do a quick Rena test. I'm going to tap the tuning fork. I'm going to place it on the bone behind your ear. Then I'm going to move it to the front of your ear, and I want you to tell me which is louder. Is it louder 1 or louder 2? Okay. Other ear. Is it louder 1 or louder one's really quick. Yeah, and of course you passed with flying colors. Now I'm going to do the whispered word test. I'm going to get up close to you and I'm going to whisper several words into your ear. And I just want you to tell me, repeat to me, what those words were. Ice cream. Good. Candy. That's right. Popcorn. All right, good, popcorn. Now we're going to do the next ear. Cheese. Good. Strawberry. Yes, strawberry. And cake. All right, great job. Yep, you got every single one right. No hesitation. Alright, now I'm going to be testing cranial nerves 9, 10, and 12 in a cluster. We've got the glossopharyngeal, the vagus, and the hypoglossal. Now, I've actually been testing a lot of these this entire time as we have been having a conversation. I've been paying attention to the way you articulate your speech, the way you talk, the way your tongue moves when you talk, and everything seems perfectly normal, but I'm going to do just a few tests just to confirm that there's nothing wrong that isn't, superficial, so that I can just notice it in general conversation. All right, I need you to open your mouth, stick out your tongue, and this time say ah. All right, ah. Open wider, please. Tongue out. Ah. All right, very good. Now just tongue out. Okay, everything's fine. Yeah, I'm mostly just making sure to see that the uvula is in the correct position and that your tongue isn't abnormal. All right, I want you to keep your mouth closed and put your tongue onto your cheek. I'm going to press my finger against your tongue. Okay, same thing with the other side. All right, very good. Now I want you to repeat after me, please. Same cadence. La, la, la. Okay, good. Ta, ta, ta. Okay. Ba, ba, ba. All right, one more. Ga, ga, ga. All right, very good. So it seems that you do not have any apparent nerve issues regarding your verbal speech. So we can move right on to cranial nerve number 11, and these are just accessories. So I want you to shrug your shoulders for me. Right, one more time. Okay. Now, please keep your shoulders shrugged for me. Now move your neck side to side while they're shrugged, like this. Okay. Up and down while shrugged. Again. Okay. Very nice. All right, now, again, just shrug one more time for me. I'm going to put my hands on your shoulders, and I just want you to keep your shoulders shrugged while I'm pressing down. All right, very good. All right, you can relax your shoulders now. Move around if you need to. Now, I want you to move your head to the left. Keep it there. I'm going to put my hand on your cheek and I'm going to try and move your head back over. Very good. Now to the right, same thing. All right, good job. Now head down. I'm gonna. All right, good job. And now up. All right, perfect. So all of your muscles are operating completely right. Everything is functional. Yeah, that concludes the cranial nerve examination. You passed with flying colors. Cranial nerves 1 through 12 have all been cleared. Yeah. Yes, you are cranially nerve healthy. Well, do you have any more questions for me? Well, if you would like to make another appointment, just make sure to stop at the receptionist on the way out. Yeah, she'll know everything was fine and you're just making another appointment. Anything else? All right, well, I will see you next time. It was very nice to meet you. That's right. Well, thank you very much. Have a good one.